You do not want to miss questions on ADHD in your exam. So we're going to go over the high yield points of ADHD so you can get every question right. So what is ADHD? So ADHD is a persistent pattern of inattention or hyperactivity impulsivity that interferes with functioning or development. The three main presentations per the DSM-5 are predominantly inattentive type, predominantly hyperactive or impulsive type, and the combined type, which has both inattentiveness and hyperactivity. So for inattentiveness, there's going to be organization issues, difficulty sustaining attention, and missing details. And then for hyperactivity, you're going to have excessive motor activity, the child can't stay seated, and there tends to be waiting difficulties. Now, you need to know the DSM-5 criteria for ADHD, both for your exam and in clinical clerkships. This is a common question that is asked by attendings. The patient must have at least 6 symptoms in each respective domain, so either hyperactivity or inattentiveness or combination of both, which we'll talk about a little later. And this must go on for at least 6 months, and there must be a persistent pattern. There must be clear interference with functioning, as is with most DSM criteria. There must be actual dysfunction in order for it to be a disorder. And this can be social academic dysfunction. Now, this needs to be present in at least 2 settings, either home and school or school and with peers. It can't just occur in one setting where the person is having inattentiveness or hyperactivity, because sometimes people just don't like school and that's the only place where they're lacking attention. The onset, and this is very, very important, must be prior to the age of 12. So if you have a patient that's having issues with attentiveness, maybe some hyperactivity, and they're 20-something and these symptoms just started, it doesn't meet criteria for ADHD. Now, you need to know the Vanderbilt assessment set of questionnaires because it is for parents and teachers to help with the diagnosis of ADHD. So if they ask what assessment do we use, it's the Vanderbilt assessment. All right, so as we talked about before, the patient must meet at least 6 symptoms out of either the inattention category or the hyperactivity category in order to meet criteria for ADHD. And you do not have to have all of these symptoms memorized to a T, but it's good to see them at least once so that you can recognize it on the exam. So for inattention, they might make careless mistakes and lack attention to detail. They might have difficulty sustaining attention in tasks or play. They don't seem to listen to when spoken to directly. There's difficulty organizing tasks and activities. They avoid tasks requiring sustained mental effort. And they're easily distracted by external stimuli. They don't follow through on instructions and they have difficulty finishing tasks. They can be forgetful in daily activities, and they can lose things needed for tasks. From the hyperactivity category, they can fidget, tap hands and feet, they can squirm in their seat. They can leave the seat when they're supposed to remain seated. They often are on the go or acting as if driven by a motor. They talk excessively. They run and climb excessively. They blurt out answers, often before the question is even finished being asked. They have difficulty waiting their turn, and they interrupt and intrude on others. Now that we've talked about how to diagnose ADHD, let's quickly discuss the epidemiology and etiology of ADHD. So for epidemiology, it affects approximately 5% of children and 2.5% of adults. ADHD does occur in males much more often than in females, with a ratio of 2-to-1. Of note, it is more likely that a female will go undiagnosed with ADHD versus a male, because females are more likely to try to fit in and follow social norms such as sitting in your seat, being quiet, versus males that are more likely to be hyperactive, bouncing off the walls, which result in an assessment for ADHD. If a female does have ADHD, they're more likely to have the inattentive type. Now, it does have a multifactorial etiology, with genetics being the strongest component to this etiology. If someone has a first-degree relative, such as a mom or dad, that has ADHD, they are much more likely to have ADHD. Now, it's important to know these environmental factors because it can be tested on an exam. So low birth weight, prematurity, smoking during pregnancy, that's a big one that's tested on exams. Childhood, abuse, neglect, and neurotoxin alcohol exposure all can contribute to someone ending up having ADHD. So now let's talk about the course and prognosis of ADHD. During childhood, symptoms are typically present prior to the age of 12. Remember, they need to have symptoms prior to the age of 12 in order to be diagnosed. Hyperactivity is the most prominent symptom during childhood. These are the kids that are talking excessively, they're bouncing off the walls, they're interrupting during class. And the difficulty in the school setting often triggers the diagnosis, either because they're getting in trouble in school behaviorally or their grades are suffering. Now, during adolescence, the hyperactivity decreases. The hyperactivity shifts to this inner restlessness, but the impulsivity increases. So they might be more susceptible to using substances or driving like crazy. The inattention takes over. The hyperactivity tends to go down. That's because they've learned to cope and to fit in with society, so they can't be bouncing off the walls, crawling on things they're not supposed to. As you mature, you learn how to fit into society. But you still have inattention problems. They also tend to have executive function deficits, such as planning, organization. And about 50% of adults who have met criteria as a child continue to meet criteria for ADHD or have functional impairment. It makes a good prognosis versus a poor prognosis because it might get tested on the exam. So intelligence and social support are good prognostic factors. And then early treatment also is a good prognosis factor. A poor prognosis is severe comorbidities with the ADHD. And ADHD does come with a high comorbidity. It's pretty rare for someone to just have pure ADHD. Most kids have at least one comorbid condition, such as ODD, anxiety, or a learning disorder. Because early treatment is a good prognostic factor, we need to know how to treat ADHD. First line is stimulants. Stimulants increase dopamine and norepinephrine. You need to remember that for the exam. And stimulants such as methylphenidates, Ritalin, Concerta, and amphetamines, Adderall, Vyvanse, are all considered first-line treatment for ADHD. Now, second-line treatment is Atomoxetine or Strattera. It is a non-stimulant that increases norepinephrine. It is good for patients that have a history of substance abuse because you don't want to give someone an addictive medication if they already have a history of addiction. So if the test question asks about someone with alcohol use disorder and they have a new diagnosis of ADHD, you want to start them on Strattera, not a stimulant. There are other adjunctive treatments, such as alpha-2 agonists, such as clonidine and guanfacine, and Wellbutrin can be used off-label for ADHD. So if you have someone with depression or they want to stop smoking, in addition to having ADHD, Wellbutrin might be a good choice. Therapy also can be used to help build skills to be able to cope with ADHD. And you also want to treat the comorbidities, as we discussed before. There's a high comorbidity with ADHD. Now on medication treatments. There's behavioral modification, such as social skills training and structure, which we briefly discussed. There's educational interventions, such as IEP, 504s, and the front row seating. There also can be parent interventions, such as psychoeducation and consistency training. It's important to know high-yield comorbidities as well, because they might show up on your exam. So high-yield comorbidities are oppositional defiant disorder, or ODD, conduct disorder, and specific learning disorders. If you want more high-yield psych videos, click on the playlist on the right. Otherwise, let's start the rapid review. There are 3 subtypes of ADHD: inattentive, hyperactive, and combined type. For the DSM-5 criteria, there must be at least 6 symptoms for a duration of 6 months in at least 2 settings, typically home and school, and the onset must be less than 12 years old, and there must be functional impairment. Stimulants are first-line treatment, methylphenidate, amphetamines. And Strattera can be used for those who have ADHD plus substance abuse. Adjunctive therapy can be alpha-2 agonists. Comorbidities that are most common are ODD, conduct disorder, and learning disorders. That's it for today. Good luck on your exam.